Well, welcome back, and thanks for joining us this morning. And joining us now for our Medical Monday segment, Dr. Jeff Thompson, the CEO at Gundersen Lutheran. Dr. Thompson, very good to see you this morning.
Morning, Dave.
We had a bit of a chuckle just a couple of minutes ago because we said in the next couple of minutes we're going to talk about health care reform, but we're going to do our best to narrow that focus, sir. And maybe I can begin by asking you what you have found is the most significant aspect for your hospital.
I think the most significant thing that's happening immediately is that more patients are becoming enrolled in Medicaid programs. That is, the biggest parts of healthcare reform were insurance reform. And so although the ones for small businesses haven't really kicked in yet, there's certainly been a larger increase in patients on Medicaid. So those people that are very low income who did not have coverage before have coverage now, and so they're coming in larger numbers than they had before.
What kind of challenge does that create for you, Dr. Thompson?
I think the challenge is to say, how can we work with this population that did not have as good of access to health care as they do now, and help keep them as healthy as possible, but also take care of them as efficiently as possible, because it's not a secret, and the government officials will tell you they know that neither state or federal payments fully pay for taking care of Medicaid or Medicare patients, and therefore the shift then moves on to other businesses to help pick that up. And so we try and keep our costs as low as possible in taking care of all the population so that there's enough to go around for everyone.
Doctor, before we started talking about health care reform, we were talking about patients taking care of themselves, and there has been a push to make sure people are healthier. Have you noticed a difference there, and is there a measure of success you can tell us about in that campaign?
I think there's two big areas that are pushing that. One, I think the steady drumbeat of information saying obesity, smoking, alcohol abuse, all those things result in underlying problems that cost individuals and our communities a tremendous amount in healthcare. I think the other pieces that are part of that have to do with insurance changes that require preventive care have no deductible. So people for elective or semi-elective activities with high deductibles tend to stay out. But one very good sign is as more and more insurance has free preventive care, people are getting in. So we have higher screening rates for breast cancer, for colorectal cancer, for cervical cancer, for immunizations for both children and senior citizens. Those are very good signs and hopefully will move the population towards better health.
Dr. Thompson, in our very brief time, we've covered some ground, and it's very good of you to join us this morning. Thanks for your time today.
Anytime, Dave. Thanks.
Thank you. Thank you very much. Good to see you.